A study by Utah Clinical Research Lab shows an unexpected life-threatening side effect from pain medications.
In fact, as Ed Yeates reports, it may indicate why some patients suffering from chronic pain do well during the day, but at nighttime they run into problems.
That's right, Amanda. Salt Lake-based LIFETREE clinical research has found that opioid-based pain medications may cause sleep apnea, and it may only take a moderate to a high dose to bring it on.
Clearly, people who are taking their medications as directed may still be at considerable risk.
Dr. Lynn Webster published the findings in the Journal of the American Academy of Pain Medicine. The sleep apnea he's talking about is not the usual kind we see in patients tested for in sleep centers like this. It's what is called central sleep apnea, in which while sleeping there is no effort to breathe.
This information may help us try to understand why we've seen such a large increase in the unintentional overdose deaths across the country.
This serious form of respiratory depression doesn't appear to affect all people, and Dr. Webster says since the pain medications are often used on cancer patients, in which pain control is essential, those patients can easily be treated for the apnea. In fact, he says that apnea treatment may actually lower the dose of medication needed to treat the pain. The Utah Research Lab has also been involved in some very unusual clinical trials that could lead to the development of pain meds that work well when prescribed, but will block the narcotic high if misused. A look at that when I return on Eyewitness News at 6:30.
Thank you. Being pregnant may...
Pending FDA approval, a new generation of pain pills will have an unexpected surprise for those trying to misuse the medications.
In fact, Ed Yeates reports a Utah-based research lab has been testing some of the new chemistry in clinical trials.
Prescription painkillers in the right hands do a lot of good, especially in treating something like severe cancer pain. But in the wrong hands?
OxyContin is a drug that you can crush, and you can get all of the oxycodone, the active opioid, out, and you can inject it or you can snort it and you can chew it, and you can get all of it immediate.
But that may end with the formulation of new generation prescription drugs. While manufacturers can't really block addiction, they can make it difficult for those who break or crush the pills to get at that instant reward.
The incentive won't be there because what they'll often get is nothing, or maybe they'll even have an aversive response and feel ill, slightly ill.
The reaction occurs only if the medication is altered, not when it's taken as prescribed. While we can't show the actual participants in the study, this is the room where it all happens. They are given in random fashion both the opioid and the antagonist.
Adding an antagonist, meaning something that reverses the opioid's effect, if that formulation or capsule or pill is crushed or in some way altered in a way, then all of the reversal medicine becomes active.
Products now in clinical trial, this one, in which the OxyContin is embedded within this glue-like matrix that makes it very difficult to extract if the pill is altered.
We've frozen it, fractured it, put it in a coffee grinder, and then put alcohol with it or water and tried to separate it, and it's almost impossible to separate it.
And as already mentioned, this drug, the narcotic painkiller, is encased in some beads, the antagonist medication in other beads. Dr. Lynn Webster with LIFETREE Clinical Research says if the pill is crushed or altered for a quick fix, the damaged antagonist beads reverse the effect. Ed Yeates, Salt Lake City.
The first of these new generation painkillers may be available for consumers sometime next year.
Very interesting.
Yeah.
And this gentleman wants...
Welcome back. New research shows pain medication may cause life-threatening side effects. The Journal of the American Academy of Pain Medicine released findings that opioid-based pain medications may cause sleep apnea. Although the drugs may be helping with the pain during the day, they can cause the patient to not breathe at night while sleeping. Taking moderate to high doses of prescribed medication can cause the sleep apnea.
We've seen an unfortunate...